Welcome everyone, and thank you for joining today. In this session, we're going to take a reflective look at childhood behaviour. What sits within the broad range of typical development, what may signal underlying needs, and why behaviour is often the most honest communication a child has. In early childhood especially, children don't yet have the language, cognitive flexibility, or emotional regulation systems to tell us precisely what is overwhelming them. Instead, their behavior becomes their voice. That behavior may show up as clinginess, withdrawal, big emotions, aggression, avoidance, or sensory seeking. None of these behaviors occur randomly. They are patterns shaped by the child's brain development, temperament, relationships, and experiences. Modern research highlights an ecobiological model of behavior, an interplay between genetics, neural development, caregiving responsiveness, stress exposure, and environmental predictability. When we understand behavior within this wider developmental context, we shift from reacting to surface-level actions to asking deeper, more curious questions, such as, what is this child trying to communicate? What skills are still developing? What is happening in the child's environment? This shift is the foundation of early identification, early support, and positive long-term developmental outcomes. The purpose of today's session is to give you a practical and very usable developmental framework for interpreting children's behavior. We'll differentiate between behavior that sits comfortably within the expected range for a child's age and temperament, and behavior that may point toward emotional, developmental, neurological, or sensory needs. Children's behavior is not random. It reflects their internal state, their stress load, their capacity for self-regulation, their communication skills, and the quality of the relationships they rely on. Behavior is dynamic and highly shaped by caregiver interaction. Research shows that in the early years, the brain develops millions of neural connections rapidly, and experiences, especially adult responsiveness, directly shape the child's stress response system, emotional understanding, and learning pathways. By the end of this session, I want you to feel more confident recognizing both the wide range of typical behaviors and those that may signal deeper concerns. Early identification is powerful. It produces long-term impacts, strengthens family capacity, and supports children before challenges escalate. You are often the first to notice patterns, and that makes your role critical. This topic matters because behavior is one of the earliest and most reliable indicators of how a child is coping developmentally, emotionally, and neurologically. Before children develop the language and abstract thinking required to express their internal experiences, they communicate through actions. Behavior becomes their first language. Children who feel overwhelmed, confused, overstimulated, or disconnected will show us through their behavior long before they can explain it. When we view behavior only at the surface level as compliance or defiance, we miss the deeper developmental message underneath. Early identification is crucial. Research consistently shows that when concerns are noticed early and children are connected with the right support, their long-term academic, emotional, and social outcomes improve significantly. Early intervention strengthens neural pathways, supports emerging skills, and reduces the risk of secondary issues such as anxiety, behavior escalation, or poor self-esteem. This work is not done in isolation. Effective support requires cross-sector collaboration. Educators, GPs, paediatricians, psychologists, occupational therapists, speech pathologists, social workers, and support coordinators all bring unique insights into the child's functioning. When communication across these systems is strong, children receive more accurate assessment, faster support, and more coordinated therapies. The reason this topic matters so much is simple. Behavior tells a story, and when we read that story early, we change children's futures. Children's behavior is shaped by a complex interaction of developmental, biological, relational, and environmental factors. No single factor explains everything. Instead, behavior emerges from the interplay between a child's internal world and their external environment. Developmental stage plays a central role. A 2-year-old has a completely different capacity for regulation, problem solving, and communication compared to a 6 or 10-year-old. Expecting skills that have not yet developed can create unnecessary frustration for both adults and children. Temperament also contributes significantly. Some children are naturally more adaptable, and others are sensitive, intense, easily overstimulated, or slow to warm. These temperament traits show up in infancy and remain relatively stable across life. The environment includes sensory demands, routine predictability, physical space, transitions, noise level, peer dynamics, and the emotional tone of the home or classroom. Even small environmental changes, like a new baby, a move, or a different classroom routine, can have big effects on behavior. Relationships and attachment form the foundation of emotional and behavioral development. Attuned, responsive caregiving fosters secure attachment, which supports self-regulation, resilience, and communication. When relationships are strained or inconsistent, children may become more reactive or withdrawn. Finally, stress or trauma history has a major impact. Stress chemicals influence how the developing brain processes emotion, attention, and safety cues. Children who have experienced big or small traumas often have heightened stress responses and may appear jumpy, shut down, oppositional, aggressive, clingy, or avoidant, not out of choice, but out of survival. When we consider behavior through all these lenses, our interpretations become far more accurate and compassionate. One of the most important parts of interpreting childhood behavior is knowing just how wide the range of typical behavior really is. Children grow at different rates across emotional, social, cognitive, communication, and sensory domains, and their behavior reflects where they are developmentally, not where we might expect them to be. In early childhood, it is completely normal for behavior to be big, messy, and inconsistent. Tantrums, difficulty sharing, strong preferences, emotional outbursts, and struggles with turn-taking are not signs that something is wrong. They reflect children learning to manage frustration, navigate social interactions, and express needs in a world that often moves faster than their communication skills. Typical behavior often appears illogical to adults because young children lack the brain maturity needed for reasoning, impulse control, or emotional foresight. The parts of the brain responsible for planning, calming, and thinking through consequences develop slowly and unevenly. This is why even bright, verbal children may become overwhelmed by transitions or shift dramatically from calm to distressed in seconds. These patterns are expected, especially in the preschool years. We also expect behavior to vary depending on context. A child may cope beautifully at home, but struggle at kinder because of noise or unpredictability. Or they may behave differently with certain peers, during specific routines, or when hungry, tired, or overstimulated. Variability is a hallmark of typical development. The key features of typical behavior are it occurs inconsistently, not every day, not in every situation. It responds to adult support. A child can settle with co-regulation, structure, or reassurance. It gradually improves as communication, emotional literacy, and self-regulation skills grow. It does not significantly impair learning, safety, or relationships. Developmental norms also vary by age. A 2 to 4-year-old may have frequent tantrums, use parallel play, so playing alongside another child rather than with them together, strong routines, or difficulty waiting are also common in this age group. A 5 to 7-year-old might still struggle with turn taking, emotional control at times, or peer conflict. An 8 to 12-year-old may test boundaries, negotiate rules, or experience social bumps as friendships become more complex. Understanding this broad, diverse range of typical behavior prevents over-identification of concerns and helps us recognize when behavior truly falls outside developmental expectations. It's not about dismissing behavior, it's about recognizing which behaviors belong to normal growth and which may be signaling underlying needs. Behavior becomes concerning when it goes beyond what we would expect for the child's age, temperament, and environment. 4 key indicators help us determine when to be concerned: frequency, intensity, duration, and impact. For example, a toddler having occasional 5-minute tantrums is expected, but a 5-year-old experiencing 40-minute meltdowns daily across environments with slow recovery is showing a pattern outside developmental norms. These behaviors are not discipline issues, they're signals of distress or unmet developmental needs. We also look at cross-context consistency. Behavior triggered only by a stressful event at home may require family support, while behaviors occurring across home, school, and extracurricular settings are more likely related to developmental, emotional, or neurobiological factors. Impact is another major factor. If a behavior is significantly affecting a child's learning, social participation, relationships, or sense of safety, further exploration is warranted. Even if a behavior occurs infrequently, its impact might be large enough to require referral. Chronic stress also affects behavior. Children in overstimulating, unpredictable, or emotionally tense environments may show increased dysregulation, emotional outbursts, or shutdowns. Stress affects brain regions responsible for attention, impulse control, memory, and emotional regulation. A helpful reframe is this: instead of asking, "Is this behavior bad?" ask, "Is this behavior functioning as a signal of unmet needs?" If the answer is yes, or even maybe, early referral is recommended. To better understand concerning behaviors, it helps us to organize them into developmental domains. Behavioral challenges tend to cluster in 4 or 5 key areas, each reflecting different underlying neurological or developmental systems. The emotional regulation domain includes behaviors related to difficulty calming, intense emotional reactions, prolonged stress, shutdowns, avoidance, or emotional unpredictability. These behaviors tell us about a child's internal stress regulation system. The social communication domain includes challenges with joint attention, reciprocal interactions, reading social cues, forming friendships, or understanding perspectives. These patterns often reflect communication or processing differences. The attention and learning domain includes distractibility, impulsivity, difficulty following instructions, inconsistent academic performance, and task avoidance. These may reflect executive function differences, learning disorders, or anxiety. Repetitive behaviors and sensory needs include sensory seeking, sensory avoidance, rigid routines, repetitive movements, and behaviours driven by overwhelm or self-regulation needs. These often relate to sensory processing differences or neurodevelopmental profiles. Finally, aggressive or high-risk behaviours reflect severe dysregulation or overwhelm. These behaviours can be the tip of the iceberg for underlying emotional, sensory, or developmental difficulties. Breaking behaviours into domains helps us identify patterns, understand possible underlying causes, and guide families toward relevant assessments and supports. Emotional regulation is one of the most complex developmental processes children must master, and it develops gradually over many years. Infants and toddlers rely almost completely on adults to regulate their nervous systems. Through repeated experiences of co-regulation, being held, soothed, validated, children learn to internalize calming strategies. Typical emotional regulation challenges include short situational outbursts, frustration during transitions, or difficulty managing disappointment. These behaviors improve as children's language skills, brain development, and environmental predictability strengthen. Concerning emotional patterns include daily meltdowns well beyond developmental expectations, long recovery times, shutdowns, or minimal response to adult support. Some children become physically overwhelmed, while others withdraw completely. Both responses signal difficulty maintaining internal balance. Emotional dysregulation often reflects underlying differences in stress response systems, sensory processing, communication or language, executive functioning, attachment, or relational consistency. Children experiencing chronic stress may have overactive alarm systems. Small triggers feel enormous to them. Similarly, children with sensory sensitivities may become dysregulated simply from environmental overwhelm, noise, lights, textures, unpredictability. Concerning emotional patterns require early support because without help, they can impact social relationships, school readiness, attention, learning, and long-term mental health. With the right intervention, co-regulation, modeling, sensory supports, predictable routines, and emotion coaching, children can make remarkable progress. Social and communication development is one of the richest indicators of a child's overall developmental health. These skills are shaped by temperament, early attachment relationships, language exposure, cultural expectations, and the child's interactional environment. In typical development, we see children gradually becoming more socially aware and motivated to connect. Young children show interest in peers, engage in simple turn-taking games, begin to share experiences, and experiment with pretend play. Some children are naturally shy or slow to warm, and this falls well within the range of typical temperament. However, concerning signs emerge when a child shows difficulty engaging in reciprocal interaction. This might look like limited back and forth play, reduced eye contact, or difficulty recognizing social cues such as facial expressions or tone. Children may misunderstand jokes, struggle to interpret intent, or respond in ways that seem mismatched to the social situation. Joint attention is another key milestone. Children typically look at an object, then back at an adult to share interest. When a child does not initiate or respond to these shared moments, especially by preschool age, it may suggest early social communication differences. Flattened affect, unusual emotional expression, or interactions that feel one-sided can indicate challenges in reading social contexts or expressing themselves effectively. Some children may connect intensely but struggle with flexibility, while others may avoid peer interaction altogether. Understanding these patterns helps us identify when children may need support in social skills, pragmatic language, or autism-related developmental differences. Early support is crucial because social communication skills underpin friendships, classroom participation, emotional well-being, and long-term life satisfaction. Attention, learning, and behavior are deeply interconnected. The brain systems responsible for attention, working memory, inhibitory control, cognitive flexibility, are still developing throughout childhood, which is why distractibility or impulsive behavior is common in early years. Typical variations include difficulty sustaining focus during non-preferred tasks, needing reminders, or becoming distracted in busy or sensory-rich environments. Many children thrive when tasks are broken down, routines are predictable, and expectations are clear. Concerning patterns arise when attention challenges are pervasive, persistent, and impairing. A child may appear constantly on the go, unable to remain seated for even short periods, or unable to engage with learning tasks for more than a few moments. They may not seem to hear instructions, but in reality may be struggling with processing speed, language comprehension, or working memory limitations. Learning difficulties often present subtly at first: difficulty retaining information, inconsistent academic progress, or avoidance of literacy or numeracy tasks due to frustration or anxiety. Over time, these children may internalize beliefs that they are bad at school, resulting in reduced confidence and increased emotional distress. These patterns can indicate ADHD, specific learning disorders, developmental language disorder, auditory processing difficulties, or neurodevelopmental differences. Importantly, attention issues are rarely about motivation. Children typically want to succeed, but their cognitive systems may need targeted support. Understanding the developmental basis of attention helps us respond with compassion, structure, and appropriate therapies, rather than misunderstanding these behaviors as defiance or lack of effort. Sensory processing shapes how a child experiences their world. Some children are naturally more sensitive to sound, light, touch, or movement, while others seek sensory input to regulate their nervous system. These differences are strongly temperament-based and appear early in development. Typical repetitive behaviors include enjoying predictable routines, repeating favorite games, or engaging in sensory activities like swinging or playing with textures. These behaviors can help children feel organized, calm, and secure. Concerning sensory or repetitive behaviors are those that significantly impact participation or cause distress. For example, a child may struggle with loud environments to the point of meltdown, refuse certain clothing due to tactile sensitivity, or experience panic during routine changes. Others may frequently spin, crash, jump, or seek deep pressure to an extent that disrupts learning or social engagement. Repetitive behaviors such as lining up objects, pacing, hand flapping, or repeating phrases may serve as self-regulatory strategies when a child feels overwhelmed or when processing demands exceed their capacity. These behaviors are not inherently problematic, but when they limit flexibility, social interaction, or daily functioning, further exploration is warranted. Recognizing sensory needs helps us adjust environments and expectations, reducing overwhelm and supporting self-regulation. Occupational therapists play a key role in assessing sensory processing and helping families and educators understand how sensory profiles influence behavior. Aggression and oppositional behavior are some of the most challenging behaviors for adults and caregivers to navigate. It's important to remember that young children often use physical behavior, hitting, biting, grabbing, as a way of communicating needs when language or regulation skills are still emerging. However, concerning aggression appears when these behaviors persist beyond the age when children typically develop alternate strategies. A child who frequently lashes out, destroys property, or becomes physically aggressive across settings may be experiencing overwhelming emotions, unmet sensory needs, communication challenges, or trauma-related stress. Oppositional behavior may show up as refusal, defiance, or arguing. When severe, this often reflects underlying frustration, anxiety, language difficulties, or a mismatch between expectations and the child's developmental capacity. It is rarely intentional misbehavior. Safety-related behaviors are among the most critical red flags. Acts like fire setting, cruelty to animals, or intentional self-harm require immediate referral to specialized services. These behaviors signal extreme distress or underlying mental health concerns that need urgent and comprehensive assessment. Our role is to recognize that aggressive or risky behavior is often a sign of a child in emotional overload. The earlier we intervene, the better the long-term outcomes. When we frame behavior as a symptom rather than a problem, we shift into a more curious and compassionate stance. Behavior rarely exists in isolation. It is almost always the outward expression of an internal experience. Children do not behave in challenging ways because they want to upset adults or misbehave. They behave in ways that match the skills they currently have and the stress load they are carrying. A child's behavior may be signaling anxiety, which often shows up as avoidance, clinginess, irritability, tummy aches, or refusal. Anxiety is particularly common during periods of transition or uncertainty. It may look like oppositional behavior on the surface, but beneath it is a child trying to stay safe. Autism can present through social communication differences, rigid routines, sensory needs, or a preference for predictable patterns. These behaviors are not intentionally difficult. They reflect differences in processing, communication, and self-regulation within the brain. ADHD influences behavior through impulsivity, hyperactivity, difficulty sustaining attention, and inconsistent performance. A child who can focus intensely on one task but not another is not being selective. They are experiencing neurological differences in attention regulation. Learning disorders may present as avoidance, frustration, inattention, or behavioral outbursts during academic tasks. Behavior may escalate not because the child refuses to try, but because trying is mentally exhausting or humiliating. Speech or language delays can cause aggressive behavior, shutdowns, or withdrawal. A child who cannot express their needs effectively may resort to behavior to communicate distress or frustration. Sleep disorders significantly impact behavior. Poor sleep affects impulse control, attention, frustration, tolerance, and emotional regulation. A tired child may seem oppositional when they are simply exhausted. Stress or trauma influences the nervous system. Children may become hypervigilant, easily startled, withdrawn, overly compliant, or unpredictably explosive. Behavior may reflect survival strategies rather than defiance. Family instability, changes in caregiving arrangements, illness, or conflict can all influence a child's emotional world. Behavior becomes the signal that something is overwhelming them. When we recognize behavior as communication, the focus shifts from how do we stop this behavior to what is this child telling us? That question is the key to uncovering what support is needed. When deciding whether to refer, it helps to have a simple, reliable framework. Too often, adults hesitate to refer because they fear overreacting. But research shows that early consultation is far more protective than waiting until concerns deepen. Use these core questions as a quick triage lens. Is the behavior developmentally typical? If a behaviour is significantly beyond what we would expect for a child's age, either too advanced, too delayed, too intense, or too persistent, it warrants further exploration. Is it happening across settings? Behaviour that appears at home, at school, and in community settings is more likely connected to underlying developmental or emotional needs than environmental triggers. Is the child distressed? A behaviour that looks manageable externally may still be causing internal distress for the child. Frequent anxiety, overwhelm, shutdowns, or meltdowns are important clues. Are caregivers or educators concerned? Families and teaching staff are expert observers. If they feel something is not quite right, that instinct should be taken seriously. Is learning, participation, or safety impacted? If behaviour is limiting a child's ability to attend, connect, or stay safe, early referral is essential. If you answer yes to even 2 of these questions, it is appropriate to consult or refer. Early intervention is not labelling, it is providing clarity, reassurance, and access to support before challenges become entrenched. Early action is one of the most powerful protective factors that we can offer. Referral is not about assuming the worst. It is about ensuring the child receives the right type of assessment at the right time from the right professional. It's about clarity and support for families, not diagnosis alone. GPs are often the central coordinating point. They can rule out medical concerns, such as hearing or sleep issues, provide referrals to paediatricians, and help families access mental health care plans. Paediatricians assess developmental, medical, neurological, and behavioural concerns. They investigate global development, growth, sleep, feeding, regulatory disorders, and neurodevelopmental conditions like autism or ADHD. Psychologists can assess emotional regulation, anxiety, trauma, learning difficulties, behaviour, and cognitive profiles. They also support children with coping strategies, emotional literacy, and social emotional skills. Speech pathologists assess communication, pragmatic language, comprehension, expressive language, and social communication differences. Occupational therapists assess sensory processing, motor development, daily living skills, emotional regulation, and school readiness. Behaviour specialists support families and educators by analysing patterns, identifying triggers, and designing support plans that reduce distress and increase skills. Child and adolescent mental health services are essential for complex presentations involving trauma, risk, or significant emotional difficulty. Referral is indicated when development appears to be plateauing or regressing, behavior is significantly disruptive or distressing, a child struggles socially, emotionally, academically, or adaptively, parents or educators consistently express concern, or safety is compromised. Referring early helps families understand their child's needs and prevents escalation. You are not passing the child on, you are widening the team around them. Conversations about behavioural concerns can feel sensitive, especially for families who may already be worried or unsure. The way we communicate can either open the door to support or unintentionally create shame or defensiveness. Begin by focusing on specific observable behaviours rather than interpretations. Instead of, he's aggressive, say, we've noticed that 3 to 4 times per week he becomes physically upset when another child takes a toy, and it takes him up to 15 minutes to calm. Avoid language that implies blame or judgment. Behaviours are not evidence of poor parenting, they are evidence of developmental needs. Use compassionate framing. This may be nothing, but it's something we'd like to explore together. You are not alone in this. We see this in many children, and early support makes a big difference. We want your child to thrive, and looking into this now can help prevent challenges later. Be mindful of cultural considerations. Families may have different expectations of development depending on cultural norms, extended family involvement, or community values. Approach each conversation with curiosity rather than assumption. Offer clear next steps, not vague concern. Provide the family with accessible resources, referral pathways, and encouragement. Invite partnership by asking, "What have you noticed at home? Does this behavior happen in other environments? How can we support you through the next steps?" Above all, reassure families that early identification does not label a child, it supports them. Case examples help us put theory into practice and understand what concerning behavior looks like in everyday scenarios. Case 1 is a 4-year-old with daily meltdowns at kinder. Do you think that is typical or concerning? Should we refer or not? This child may be experiencing sensory overload during transitions at kinder. They may struggle with unpredictability, noise, or separation. These meltdowns are not tantrums, they are signs of emotional dysregulation. An OT referral can clarify sensory needs, while psychology support can build emotional literacy and coping strategies. Case 2 is a 7-year-old who is struggling with friendships and rigidity. Do you think this is typical or concerning? Should we refer or not? A child who wants friends but frequently misreads social cues might be experiencing pragmatic language difficulties or early autism-related differences. Rigidity in thinking, difficulty joining play, or becoming upset when routines change are meaningful patterns worth exploring. A speech pathology assessment for pragmatic language and a paediatric referral are appropriate. Case 3 is a 10-year-old who is refusing school and is anxious at drop-off. What do you think? Is that typical or concerning? Do we refer or not? School refusal is almost always rooted in distress, often anxiety, academic difficulty, or sensory overload. Avoidance is the child's attempt to regulate internal discomfort. Early referral to psychology helps identify emotional triggers, while collaboration with school staff ensures consistent support. These examples remind us that behavior is a signal. When we view behavior through a developmental lens, we see pathways for support rather than problems to be corrected. As we move toward the end of this session, a few key principles stand out. Behavior is communication. It reflects a child's internal state, skills, and stress load, not their motivation or intentions. Concerning behavior is frequent, intense, persistent, or impairing. If a behavior is happening a lot, is unusually strong, lasts a long time, or affects participation, early support is needed. Early referral is protective. It improves outcomes, prevents secondary challenges, and supports families before patterns become entrenched. Collaboration is essential. No single professional sees the whole picture. When educators, GPs, allied health clinicians, and families work together, outcomes improve dramatically. Trust your instincts. If something feels developmentally unusual, even if you can't name it yet, it is worth exploring. Ultimately, children thrive when the adults in their world respond with curiosity, compassion, and timely support. There are many resources available to guide your decision making and help families access support. These tools are not meant to replace your clinical or educational instincts, they are meant to complement them. Developmental milestone checklists help differentiate typical from concerning patterns and guide discussions with families. School or early learning wellbeing teams may provide observation, documentation, behaviour planning, or short-term interventions. GP referral pathways connect families to paediatricians, allied health professionals, and diagnostic services. Allied health providers, such as speech, OT, psychology, and behaviour therapy, offer structured assessments and tailored therapy to support communication, sensory needs, emotional regulation, and learning. Early childhood intervention services provide multidisciplinary support for children aged 0 to 6 with identified developmental delays or disabilities. Family and community services, parent helplines, and mental health resources can support families experiencing stress or uncertainty. No single resource solves everything, but when combined, they provide a strong framework for early identification, timely referral, and holistic support for children and families. Let's go through some frequently asked questions. What is the difference between a tantrum and a meltdown? Tantrums are usually goal-driven. The child wants something and is frustrated they can't have it. They maintain some awareness of the environment and may stop if the goal is met. Meltdowns are neurological overload. The child is overwhelmed by sensory, emotional, or cognitive input and loses regulatory control. They cannot stop simply because they want to. They require co-regulation instead of consequences. What does shutdown behavior look like? Shutdowns occur when the nervous system becomes overwhelmed. Children may withdraw, become silent, avoid eye contact, refuse tasks, hide, or appear frozen. Shutdowns are similar to meltdowns and are often mistaken for non-compliance. They reflect distress and require calm, supportive approaches to restore safety. Can cultural or multilingual backgrounds affect milestones? Culture and multilingualism shape how children communicate, not whether they communicate. Children growing up in multilingual households may mix languages or take a little bit longer to produce words, but foundational milestones such as eye contact, gestures, pointing, social engagement, or responding to their name stay consistent worldwide. So we remain alert to red flags even when multilingualism or multiculturalism is part of the picture. What are the early signs of autism? Early indicators may include differences in social interaction, limited joint attention, preference for predictable routines, sensory seeking or avoidance, repetitive play, or literal communication styles. These signs do not confirm autism, but indicate that a developmental assessment may be helpful. How can I support a child with sensory needs? Begin by identifying triggers and thresholds. Is the child sensory seeking or sensory avoidant for each sense? Support may include reducing sensory load, offering sensory breaks, providing movement input using noise-reducing tools, or preparing the child for transitions. OTs can provide tailored sensory strategies. What role does anxiety play in behavior? Anxiety often presents behaviorally rather than verbally. Children may show avoidance, irritability, shutdowns, school refusal, physical symptoms, or clinginess. Behavior perceived as defiance is often an attempt to reduce internal discomfort or regain a sense of safety. What strategies help with emotional regulation? Co-regulation is the foundation. Adults must model calm before expecting it from children. Strategies include predictable routines, visual supports, naming emotions, sensory tools, movement breaks, and structured calming practices. Regulation skills are learned gradually over years. How can schools support children with behavioural challenges? Schools can provide predictable routines, visual timetables, breakout spaces, structured transitions, positive behaviour support plans, sensory accommodations, social skills teaching, and regular communication with families. Collaborative, consistent approaches are key. What is the difference between ADHD and typical distractibility? Typical distractibility is situational and improves with reminders. ADHD-related attention differences are persistent across settings and significantly affect learning, safety, or daily functioning. Children may struggle with working memory, impulse control, and sustained attention even with support. How can I identify learning-related behavior challenges? Look for behavior changes that occur during literacy, numeracy, or structured tasks. Avoidance, frustration, task refusal, or emotional escalation may signal difficulties with processing, comprehension, memory, or academic skills. A learning assessment can clarify underlying needs. Before we close, here's the key message. You don't have to manage developmental concerns alone. SLCN is here to partner with you. Why refer to SLCN? We have specialized holistic developmental assessment and integrated therapy across communication, social emotional, behavior, motor, daily living, and mental health. We provide clear functional reports with practical recommendations for home, kinder, or school. We collaborate with families, with GPs, schools, kinders, and NDIS partners. We provide timely appointments. We prioritize early access and availability. When to refer. Any child with delays in speech, language, social, emotional, or behavior concerns, motor or daily living challenges, executive difficulties, regression, or persistent parent-educator concern. How to refer. By phone, email, or web, and our location is based in Derrimut in the western suburbs. If a child came to mind today when we were talking about milestones, then that's your referral. I encourage you to think about the children you support every day. If today's session has prompted you to reflect on a child who may need a bit more help, that's the ideal moment to refer. Your observations truly change developmental pathways. Early action prevents long-term challenges and empowers families at exactly the right time. Thank you for your time and for the vital roles you play in children's lives. I'm happy to take questions about red flags, referral pathways, or specific scenarios you're seeing. If you'd prefer, feel free to connect after the session. We're here to support you, your team, and the families you work with.